Will you come closer, top view? Okay. The skull can be studied from all views. When we start from the top view, in Latin is called norma vertical. On the top view, we have these bones that make the cap of the skull. The most anterior one is the frontal bone. Next, to each side, we have two parietal bones. They unite with what's called suture line. So that is the suture between the frontal and the parietal, and it's called coronal suture, or you can name it frontal suture. The sagittal suture is in between the two parietal bones. There is a diamond-shaped area between these three bones. This diamond-shaped area. It's called anterior fontanelle. And it closes completely. It means it's a bony, no more membrane between the ages of 1.5 years to 2 years. On the most back of the skull cap, we have what's called the occipital bone. That is the occipital bone. And it has a suture line between it and the two parietal bones. This suture line is called lambdoid suture. We have a triangular shaped area between the three bones called posterior fontanelle or lambda. Compared to the anterior fontanelle, diamond shape, you can name it also as Bregman. This posterior fontanelle is membrane up to the age of 6 months, and then it's bony after that. These all features from a top view. A front view or norma frontalis. It starts with the frontal bone at the top part, and then we go all the way down. You may have two bosses here, two prominent pieces of bone. We can name them frontal eminences. If they are so clear, more prominent, this is a male skull. If it is a smooth roundness, it's a female skull. Above, this is the orbit, orbital cavity for the orbit. Just above it, we have this supraciliary arch on each side. You can name it supraorbital arch also. In this arch, you have an opening. It may be open or it may be notched. If it is broken, we name it supraorbital foramen for vein, artery, and the nerve to supply sensation for this area. In between the two supraciliary arches, we have this area called glabella. Lower down to the glabella, we have the nasal bones. They are united by the middle. Here, a suture line is called internasal suture. We go lower down. Here are the two openings of your nose called anterior nostrils or anterior external nerves. It could be in the flesh like that. By the middle, we have that nasal septum. It's a midline structure, maybe deviated to one side, in case we name it as deviated septum. Lower down, we have this black dot, which is the anterior nasal spine. Lower down, we have this is the maxilla. Lower down to the maxilla, we have the superior alveolar arch, where the sockets for the teeth of the upper jaw are attached. If I have the mandible, hold on a second. There is one more opening below the orbit, which is that one called infraorbital foramen. I have one more opening in the mandible, which is this opening. We can name it mental foramen. If I'm going to pass a straight line between the supraorbital, infraorbital, and the mental, it will be a straight line. These all what you need to know about norma frontalis or frontal view of the skull. If you go to the side view of the skull, we have the top bones at the cap. This is the parietal bone. Lower down we have the temporal bone, and we have the temporal suture running between. On the sides of the skull we have two lines, two landmarks. Superior temporal line, inferior temporal line, for the attachment of a muscle at the side of the face called temporalis muscle. If you go lower down, you have the zygomatic arch. Back to the zygomatic arch, I have the opening for the external ear, is named external auditory meatus. Back to it, I have the mastoid process. These are all the features you need to know a lateral view. The most back.